So this is discharge planning when you are like trying to think about your patients. You go about these issues, and these will basically facilitate your patients moving out of the hospital. So if the patient require physical therapy, then you're gonna read the physical therapy recommendation. They will tell you what is the dispo planning. Should you go home or short rehab? You might need placement. If the patient have a Foley catheter, you should have a plan whether taking it out or you're going to send him home with a Foley, which will be new to him. And then any outpatient follow-ups, as we discussed earlier, everybody should go to the primary care within 1 week. But if there's any specialist need to be seen, and that's something that you need to be arranging ahead of time before discharge. Um, just like a tip about the specialist appointments, let's say during the hospital stay, we did a CAT scan for like his abdominal pain, and that CAT scan just picked up a nodule on his lungs. Okay, and they told you the report of the CT was saying recommended a 3 months follow-up CAT scan. So you need to document that in the note, and then you're going to mention that to the primary care. But for example, you figured another specialist need to be following this patient, which is like the lung nodule clinic. So you will put the order for lung nodule clinic outpatient right away. And on discharge, everybody is already arranged and he's already scheduled. So you don't need to worry about that at the time of discharge. I usually worry about that thing. I put the order whenever the problem arises. So we have like a concern for sleep apnea on admission. I put like a sleep clinic follow up right away. And when the time for discharge comes in, he already have an appointment with the sleep clinic right away. So just to try to be proactive about it. Don't delay it until the time of discharge. Whenever the problem arises, just put in the order for outpatient follow up. And if you don't know how to do an outpatient follow up appointment, ask your senior and ask your nurse practitioner. They will show you how to schedule outpatient appointments with different specialties. You need to document the medication changes, and you're going to figure out transportation. Some people need to go family, some people need to put orders for special medical transportation. Some people are like in a different city and they need to be discharged at a very specific certain point of time during the day so they can make it home on time. So just keep these things in mind. Otherwise, like you leave your patient who's living in Coalinga, which is like a couple hours away, towards like 4 p.m. And then when you try to discharge him, he will tell you like, sorry, my family can't make it and they will not be able to come over and pick me. And then he will stay with you another day. And that means like you're going to round him all over again tomorrow, and you will present him and you're going to put another note for no reason. He basically could be have discharged just a couple hours earlier. So I'm just trying to tell you like how to make your life easier. And whenever you have someone dischargeable, just make sure that you discharge them on time and go from there. These are the things that kind of like a checklist that you need to check before you go home at the end of the day. So you're gonna just review your orders, make sure you have, your orders are done. Usually, like you don't have like many. Usually, like 2, 3 orders per patient. It's not much. Then you're gonna review medications, make sure like if he's septic, you need to make sure that he is already on antibiotics. If he's DVT, you need to make sure that the heparin order didn't fall off and he's still on that. If someone is on like some sort of maintenance or some sort of medication that need to be given, it's already ordered. And or sometimes you have someone who's on like 3 blood pressure medication, and right now his blood pressure is soft. Maybe you need to hold off a little bit on some of his medication. So that's how you review the meds. As we mentioned earlier, the morning labs, DVD prophylaxis, bowel regimen, and always think and anticipate procedures and make sure that if there is a procedure, should he be MPO at midnight? Should we hold his DVD prophylaxis? So that will not delay his procedure. Last thing you want is you come in the morning and the patient was supposed to get a procedure to get him diagnosed, and they will tell you, sorry, we cannot do the procedure. He ate at 7 a.m. and anesthesia is refusing. or he got a DVT prophylaxis dose in the morning and we cannot do LP on him or whatever. So just anticipate the procedures and always think about NPO and DVT prophylaxis to be held. And then at the end of the day, you're gonna update your signouts. You will give the sign out to the call team, and then finish your notes. As we mentioned, these things here. You're gonna go home, relax, recharge, and come next day and finish your thing. Okay. So this is how the day goes at the VA. I hope that was a little bit